Where you start your career sets the stage for everything that's going to come next. And I remember my first steps as a young doctor being pretty daunting. There was a lot to think about. How are you going to make the most of your education? What kind of practice do you want to be a part of? And how do I keep my career on track? These are some of the big questions, and most doctors starting their careers don't have the answers. I'm going to share a few things that I wish I'd known when I was starting my career.
In many ways, the first year I spent as a doctor was like a residency. It was a bit trial by fire, but it helped me build both my clinical skills and my confidence as a young professional. Learning how our team can most effectively communicate is not only important to who we are as individuals, but it helps us educate our patients better. Dentistry is something that not a lot of patients know a ton about, so if we're able to communicate in a way that our patients can understand, it helps them feel like they're valued as a patient, and it helps us have greater success as a dental team.
Learning what your treatment philosophy is and how you're going to go about taking care of patients is different for everybody. My style when I talk to patients is a more down-to-earth approach. Coming out of dental school, I was way too technical. I was diving deep into all of the stats and information, thinking that that's what patients wanted to know, where sometimes it's as simple as just saying, this is like a crack on your windshield. And just learning simple phrases and analogies like that help go a long way to help patients understand it on their level as well.
For me, having another doctor alongside me was critical. I was able to watch them in procedures working on crowns and working on fillings. Those are the things that every new dentist is going to do a lot of, to build repetition and to get better at their clinical skills. It's also great to have a mentor critique your work. It only shortens the learning curve. In my experience, I have done more root canals than I ever imagined. I have jumped into implant surgery, and these are things that I never thought possible. There have been so many times when mentors have not only helped me, but built my confidence and propelled me at the same time.
Mentors have given me true feedback that I need to hear. They have told me my opportunities that I need to work on. That way I can strive and look for opportunities to turn those weaknesses into my strengths. Having a few peers to bounce ideas off and to answer your questions can really be beneficial.
It can be very lonely and intimidating when you are finally on your own. Having a mentor doctor that is just a phone call or an email away helps you just relieve your nerves knowing that someone is there to talk to and go through a procedure that went well, what didn't go well. You can learn so much information from somebody who has been doing this for many years.
One of the things that concerned me coming into a practice so young was demonstrating leadership in the office. I was significantly younger than a lot of my team, and I worried that I just wouldn't have the command the role required. I needed that leadership development in order to have the respect of my team and to be able to confidently go forward in my practice. There is nothing that compares to taking a leadership development course. It's something that I can't encourage enough. And when everyone is in sync, you can provide top-level care to your patients. It set me up to deal with the good days when everything goes smoothly, and to face the not-so-good days when things go wrong or team members aren't 100% perfect.
It's not just the clinical, but it's also personal. You have to grow yourself as a leader. We have the ability to take all these advanced courses, but we also have the ability to take our team members with us. They can grow with us and really help our patients when we get back in the office and start implementing those new procedures that we learned. My name is Shazam Ashraf, and I'm a Heartland Dental supported doctor.
Some of the main things that I've learned since graduating dental school was how to be a leader, to talk to patients, learning how to connect with patients, with your staff, and developing those skills I believed was one of the most important things that helped propel my career onto the path that it is today. I'm Tyler Wild, and I am a Heartland Dental supported doctor.
Seeing my classmates that I graduated with in their other careers, they're still a little bit further behind than I am. I'm also able to do more types of procedures that I wouldn't have thought that I could do 4 years out of dental school. You know, I'm tackling Invisalign and wisdom teeth and upper molar endo, and some of them are still taking a little bit longer because they had a slower trajectory when they first got started. My name is Grace Eichler, and I am a Heartland Dental supported doctor.
Once I started learning new things, I began to feel confident to take on more complex cases. It's been a great start. If I can say anything, it's that you have to keep learning. I promise you, you're capable of far more than you know. My name is Dr. Parambir Singh, and I'm a Heartland Dental supported doctor.